Lafayette General Health System's mission is to restore, maintain, and improve health. So our system consists of 7 facilities in a 9-parish, i.e. county level. A type of patient that has been helped by 340B in our system is very clear. Once we started using the savings from the 340B program about 10 years ago, it enabled us to open up 7 satellites in all the rural areas in our market share. And in those areas, 50% of these patients in general are Medicare. And about 22% of those patients are Medicaid. And these patients had to make decisions before we were allowed to open up these clinics on where and if they would get care. So when we opened up these rural clinics in 7 rural areas, the patient's pathology from day one astounded us, because these patients are, as I said, Medicare, Medicaid, and they had to make decisions. And the decisions were, do I pay the rent? Do I buy my medication? What do I do? And a lot of them paid the rent. And now that we have several years of having these cancer centers, satellites in these rural areas, we're able to get these patients quick into our system. It's close to home. And it's also enabled us to form relationships outside of our market share, like at Ochsner's, which is in New Orleans, Louisiana, and most of our bone marrow transplants, stem cell transplant patients go. So the savings from the program has enabled us through technology to have virtual tumor boards at our hospital, so these patients do not have to drive into Houston and or New Orleans, and also consult visits. So basically now the patients that are involved in our 340B program in an oncology standpoint, the only time they have to leave their community to travel is to get the procedure that they're going to that we cannot deliver, and not have to go back and forth to all these visits. If the 340B program would be scaled back or eliminated, it'd be catastrophic to the rural areas within our market. In general, 50% of the patients that we treat are Medicare, older, and 22% are Medicaid, poor. And if these older, poor people had to make a decision on to pay their rent, buy shoes for their kids, versus take care of themselves, more than likely they would try and take care of their family before themselves. And by the time we would get these people into our system, it'd be the end of the disease, and reality, the end of their life.